Minutes.
Thank you, Madam Chair. I move to strike the last word. I strongly support this amendment and the underlying bill, the Restoring Hope for Mental Health and Well-Being Act. I want to dedicate my vote today to the great Naomi Judd, who lost her battle with depression, and she lost her battle with mental illness. She made such an impact. She made such an impact on others to seek treatment. And she really did, because she spoke out publicly about this issue. And again, I appreciate her, and she's still making a difference after life. So the Restoring Hope for Mental Health and Well-Being Act, which authorizes the key SAMHSA block grant programs for mental health and substance use disorder prevention and treatment services. It contains a bill from Leader Rogers that I was proud to co-sponsor, which reauthorizes the Garrett Lee Smith Memorial Act Suicide Prevention Program, which will provide resources to states and campuses to prevent suicide in youth. It's clear that these bipartisan solutions are needed now more than ever before, since we're sadly in the midst of a mental health crisis in our nation, and it's been accelerated by the COVID pandemic. Emergency departments' boarding and wait times for placement for teens and children with serious emergency emotional disturbance and other mental health conditions are highly, again, more than ever, they go to the emergency rooms. Just this past weekend, the New York Times published a piece discussing a surge in mental health issues among teens, resulting in hundreds of instances of teens at risk of suicide, boarding, and sleeping in emergency rooms for days or even weeks at a time. I'd like to insert the article, and I know you alluded to it, Madam Chair, into the record, please, the New York Times article.
So ordered.
Thank you. The New York Times piece mentions that despite residential treatment facilities being in a much better place for these teens to stay as a calmer, more stabilizing setting, they sadly have long waits, an average of 10 days. Some cannot wait that long. The number of treatment programs for teens under the age of 18 has fallen by over 30% in the past decade, meaning emergency rooms have had to pick up the slack, a problem that has worsened since the pandemic. Experts have called this a national crisis, and it is, and I believe we must be doing more on every level of continuum care. I'm grateful we worked to address this earlier in Congress when we passed my bill, the Effective Suicide Screening and Assessment in the Emergency Department Act, to improve hospital capacity and training to identify risk of suicide and better connect them with mental health resources. In addition to this SAMHSA package, I hope we can get both bills to the President's desk as soon as possible. I urge the Senate to pass this bill immediately. This can also be addressed at the residential level, where there are programs with trauma-informed treatment models that address the mental health and behavioral health needs of children, such as foster youth, who can't always get full access to Medicaid due to IMB exclusion. I do have some time. Unfortunately, this potential solution has not been addressed in today's bills, in neither this package nor the Medicaid bill. I understand my colleague, Dr. Burgess, will also be addressing this issue later on, and I fully support him in these efforts. My bipartisan bill that I lead with Representative Castor and co-sponsored by many bipartisan members of this committee would restore access to qualified residential treatment programs, which should play a role in the continuum of care. I'm disappointed, Mr. Chairman, that we haven't actually addressed this bill, the chairman of the full committee. This issue, I hope that we address this issue as soon as possible, because we can't have these arbitrary barriers to care, particularly for our children. We can't afford to wait any longer to address the mental health crisis. This comprehensive SAMHSA mental health package presents much-needed solutions that will give hope to patients and improve access to mental health care, and I'm proud to support it. But it doesn't mean we should stop here, and I know we won't. We must work together to address suicide and mental health
So I just
across the
think,
nation.
as you're doing
Thank you
this,
so
I
very
don't
much.
think we
I
need to
appreciate
be-
it. And I yield back, Madam Chair.
I'm sorry,